Welcome back to the AME Facilitated Sessions. I'm Dr. Darren Wayne Jackson II. I'm your co-host and moderator. And today we are going to kick off our MCAT block of the Facilitated series with a very critical conversation. And you ready for the title?
Absolutely, DJ.
It is Starting Strong Wellness Strategies for the MCAT, right? So as in, I say we, let me introduce the CEO of AME and our co-host and expert facilitator, Dr. David Leon Taylor.
Thank you, DJ, and welcome back to our outstanding scholars. DJ, today's session is really going to be insightful because we're going to be talking a lot about a resilient mindset, this whole framework called a GPS framework.
Yes.
I know we talk about global positioning systems, but this GPS, there's a GPS for wellness that we're going to be talking about that I know you'll be sharing with us today in our discussion.
Yes. So just to piggyback off of what you said, now, GPS, this discusses our mental health framework. So again, the critical discussion that we're having here and the reason why it's so important to start here is because it's data based, right? If we look at reports from the AAMC, we see that about 65% of pre-medical students or medical students are reporting high stress anxiety for these high stakes exams. So that's a large proportion of our student learners who are taking exams. If we take a larger zoom of the landscape of pre-medical students and medical students and even residents, we see that the levels of burnout, stress, and anxiety has magnified just, to such a great level that we're looking at ways through, the proponents of, some of these major institutions like Johns Hopkins, Mayo Clinic, Harvard. We have APA, again, AAMC, ACGME. All of these organizations are proposing that having this hybrid type of system of mental health wellness, as well as your medical education curriculum, actually shows through the data, through the literature, to have a positive impact on students' performance and their overall well-being.
Let's hit that point right there. Everyone is concerned about their performance on these assessments. The medical college admissions test for our scholars pursuing medical school is such a major concern because it's one of the important considerations in the admissions process. And so everyone is focused on performance. And as we noted in an earlier facilitated session, in one of our other series, you talked about sometimes so much performance, there's burnout.
That burnout society.
That burnout, right?
Being Chu Han, yes.
Exactly.
The burnout society.
And so we're taking a deeper dive and slowing it down because we've received a lot of information from our scholars asking us about what's the best way to study for the MCAT. Can you help me with testing strategies? Can you help me with thinking skills? Can you help me with how do I manage all of the content? And DJ, you're reminding us before we do any of those three areas, it's about starting strong with the right mindset.
Absolutely.
And this mindset is anchored in wellness. And you've already shared with us some evidence-based research that's indicating concerns regarding the wellness. And now all of the different institutions from medical schools to graduate programs are saying, take a step back. Let's focus on how our scholars can remain well. And that will help, obviously, with engaging in their training and obviously demonstrating their success in terms of a performance outcome. And so this is why it's so important that we're slowing it down and moving through a stepwise process on wellness to kick off this first series on success in the MCAT.
Exactly. So speaking of that stepwise process, this is how today's facilitated session is going to go. First, we're going to start by outlining why having a mental health framework during your MCAT preparation dedicated time is so important. Then we're going to look at the second thing is to look at some practical steps and strategies on how we integrate a wellness framework into a longitudinal plan for your MCAT preparation. And then the third thing is, what does a mental health or wellness framework look like on game day, test day?
Excellent.
So I think that those are some critical points that as we have intentionality in our
Yes.
preparation, not just from the skills and academic standpoint, but from the wellness standpoint, that's an easy framework to break it down. So why we need it, how does it look in terms of practical steps and strategies from a long term and longitudinal plan, and then what does it look like on game day? So you ready to jump in?
Let's jump right on in.
Okay. So to put the why in perspective, a lot of times I often go online and you look at these threads as a former medical student, a resident. You see these studentdoctor.net or
Yes.
Reddit MCAT threads, which highlight a lot of different experiences for medical students and
Yes.
pre-med students. And we see an overwhelming expression of our students on these threads of feelings of frustration, fatigue, feeling overwhelmed, and as we just talked about a couple of minutes ago, burnout. It's very strong. And we already discussed the 65% of pre-meds reporting high levels of anxiety, but also a JAMA reported that 40 a JAMA report reports that 43% of medical students have depressive symptoms. So this is you see
Significant.
43% of medical students showing mood disorders, which is that shows us it's not an isolated situation, or
Yes.
this is just not something that we can just say work your best, work through. It's an epidemic, and with an epidemic, we have to have practical strategies and steps in order to combat that.
I love that practical steps and strategies. You again are sharing data now with medical students, and we have our pre-medical scholars listening, and of course we have medical students listening, residents. But our pre-medical scholars are not even in medical school yet, and you're learning about some of the pitfalls when we do not have a good wellness plan in place.
Right.
Then it carries into the rest of our medical trainings. Now we're carrying to medical school. And we know in future sessions we'll be talking about what happens in residency.
Right.
So this is, again, a very important focal point for our pre-medical scholars to start that process now with one of the more challenging areas of their pre-med journey in terms of preparing for the MCAT is to really focus on this wellness mindset. Let's get into now one of those first areas of support that students can actually use.
So, you said a lot, and I can relate heavily as someone who's taken the MCAT. I've experienced the fatigue, the frustration, just the feelings of burnout. And as you said, if it's not something that we're intentional about addressing very early on, not just in our MCAT preparation, but also within our medical careers, because guess what? Exams don't stop.
That's exactly correct.
There you will be taking many exams after the MCAT. And with that being said, me personally, not having an intentional plan on how my wellness framework works within not only my testing experiences, but also my academics as a medical student in general or a resident, these issues continue to follow. So when you talk about, we'll get into this in a little bit about thought distortions or thought errors,
Yes.
being that kind of catalyst to your negative approach or your negative feelings or these feelings of anxiety or mood symptoms.
What I call the mental saboteur coming in.
The mental
That's thought
saboteur.
distortion, yes.
That is the stepping stone for it. So it wasn't until I was intentional about having a wellness strategy, and we'll talk about these strategies in our next section when we talk about how to make your framework into a longitudinal plan. But a lot of these strategies, it wasn't until I started to be intentional and putting them into my day to day, really honing in and each and every day getting a little bit stronger in the discipline around it, that my luck, so to speak, my performance changed. And so this is why we feel it's very critical to start here with your wellness strategy, because this is kind of the meat and potatoes. We overshadow a lot of with the wellness experience and how large of an impact it has on our academic performance. But the data shows that
Very clear.
it's very clear. It's very clear, a thing that we have to tackle. You mentioned earlier the GPS
Yes.
framework, and I'll get into a little bit. So in our prep phase for this episode, I found GPS, and this is out of the Motivation Lab, which is a research group out of NYU, and they did a IMC webinar in 2024, and what they did was highlight the importance of motivational theory in practical education. So,
Okay.
settings. And so where they recommended incremental implementation of the GPS framework. And what they found was that it fosters resilience within the students, and it reduced burnout to a very significant level. So what is GPS, you ask?
Exactly, because it's not global positioning
It's
system.
not. It's not. So let's start off with the G.
All
So
right.
G stands for growth mindset.
Growth mindset. Got
Growth
it. Okay.
mindset. So this is intelligence and abilities can develop through effort and strategy, right? So let's quote this by saying, I can improve with strategies and effort, right? So this growth mindset is very important because it brings in something that sometimes gets a negative, perception, but affirmations,
Affirmations in medicine.
Now let's
All
let's
right.
let's 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 pause there and talk about affirmations, because you co-author for the book Affirmations in Medicine.
Yeah, with Dr. Susan Chang.
Yes, how important is affirmations to your journey? How important is actually seeing yourself, stating yourself, because we'll talk about how it relates to thought distortions and these automatic negative thoughts that creeps into our subconscious and grows that academic saboteur, right?
That's
From
right.
your perspective as a coach, as a mentor, as a consultant within medical education, as a dean of student learning at Georgetown University for over you were in that position with students for 30 years. What does affirmations and seeing yourself, that self-actualization, mean to your journey in medicine?
It is the most powerful tool that every scholar can possess and utilize to give them motivation to push on in their journey to physicianship. The research clearly shows, from our own research and the evidence-based research that's available, that when we take a moment to realize and focus on what has been our success to date, almost as you would say, keeping a log of your successes, it can be a very powerful motivator to remind us that we have been really truly focused on a journey. We've had a lot of accomplishments, and therefore, in perspective, a momentary setback, a momentary setback is simply just that. The thought distortion that a lot of times you refer to is the momentary setback all of a sudden looms as this major block, an impediment to move forward. And how does that happen? It is a thought distortion. So affirmations are so powerful, whether they come from within, how we reflect on our journey so far, and the good things that have happened, the accomplishments we made, or a meaningful affirmation from a peer, a faculty person, a mentor. All of that can be one strategy of true humanistic support that encourages us to move forward. And it supports the growth mindset, the G in GPS, because it encourages us to say, okay, well, I had this momentary setback. What's a strategy that I can learn from my faculty or my mentor that will help me navigate that particular setback and move forward on my journey? And that growth mindset now is the first step, of course, of our wellness.
Right. So, this brings in, when we talk about growth mindset, we talk about affirmation, it brings in a very important thing. But first, let's take a pause and define what thought, because we mentioned it
Yes.
several times. What is a thought distortion? In the psych world, we call thought distortions thought errors, right? So these are things, for example, rumination, catastrophizing thoughts, all or nothing thinking, overgeneralization, imposter thoughts, what we also call imposter syndrome. So these are all things that the mental or academic saboteur does. It gets into their automatic negative thinking, right? And it plays on repeat in a loop in our subconscious. We're not even conscious that these things are happening. And so, as you mentioned, a strategy that is supported within the data, we call it, your success logs, right? So this is measuring real objective data in your life, right?
Yes.
To the situation at hand, to be able to reframe the fact that this momentary issue of setback, or however you want to define it, is a small drop in the bucket in the main grand scheme of things, right? And so that goes into, when you have, when you're able to, have certain skills in your toolbox to catch these thought distortions. We described it in our first block, emotional intelligence, being able to first identify this thought distortion, to be able to catch a automatic subconscious thought in real time is a very hard skill to do. So we're going to talk about some clues, some keys that allows you to be able to catch that during this episode. But that's the first step, is to be able to identify that you are having a thought error, that what's going on right now in the present doesn't define me in total. This setback from an exam that I just experienced cannot justify me thinking that I don't belong here
In medicine.
and in medicine, and exploding this imposter thought within my mind because the evidence don't support it. If I look back to the fact that I'm even here preparing for the MCAT is a feat in and of itself. And everybody doesn't get a chance to sit down and prepare for the MCAT.
To be considered, to be in position to actually say, I am studying for consideration of admission to medical school based on my journey so far.
Right.
And I was reflecting on a lot of what you were saying when you said, this is not an easy skill.
No.
Which goes back to why we talk about the intentionality and how you'll be sharing with us as we move along in this FS some strategies that support that intentionality. As I had a scholar say to me one time, a long time ago, I'll never forget it. He said, you always seem to have a way to take what appears to be a negative or a setback and turn it into an opportunity of growth, the growth mindset that you talked about.
Yeah, and that's an intentional thing that you practice.
That's right. It's something I practice and I try to model for our scholars. And then he said to me, but I want you to understand, it seems easy for you because you've been doing it for so long. And I'm hopeful that one day I'll be able to do the same. And I thought about that and I said, thank you so much for sharing that with me, because that goes to part of what I do as a coach, as a mentor, etc., is that we must be sensitive to that.
Right.
And why building this community in facilitated sessions, when we talk about the mentorship and the mastery, is that we're providing an opportunity to share that information, and we're sensitive to our scholars that it's not easy. But we want to encourage you that with intentionality and then selecting some of these strategies that we'll share, utilizing some of the AME resource tools, that yes, you will be able to do that.
Right.
You will be able to have that growth mindset, the G and the GPS.
Now, let me propose something. Just and this is no shot to the mentor, your mentee, but just saying that I hope to one be able to do it is the saboteur in and of itself.
Absolutely.
Right?
Because that's part of the growth, because the saboteur is saying, well, are you really going to be able to do it?
Yeah, exactly.
So
and that's where the affirmation piece in some ways gets a bad rap, because, some people may have the perception it's just me saying these words or these sentences over and over again. But the real work in affirmation is not just saying it, it's actually
Believing it.
believing it, that you believe this to be so empirically true that your steps and your strategies, your day to day, your dedication, everything revolves around taking the action to get to that self actualization point. And we call
Yes.
that self actualization. If every day I wake up and see myself taking a negative situation and changing it into a positive, where there's no doubt in my mind that I can't take any negative situation and turn
And
it into a
change it.
positive, every step that I do in my default throughout the day is going to manifest that. So that's the reason why, this growth mindset, a part of the GPS, is so vital. And then it brings us to the P part when we talk about the self-actualization, because I know you're going to ask about that, is the purpose and the relevance. So
Purpose and relevance.
purpose and
Yes.
relevance. So P. So this is connection of academic tasks to broader life and career goals. So to quote it, I'm not studying for a score. I'm honoring my reasons for becoming a physician.
Absolutely.
Yes. Now this is very important. I know you want to speak on it and you're chomping at the bits to speak on this because this talks about your professional identity,
Yes.
right? And also in this, your skill of reflection, because how are you reflecting on your past experiences within this journey? How do you reframe that through your tools and your strategies, through
Yes.
your mental health framework? And how do you use that in terms of bringing yourself into an awareness of who you are and who you see yourself to be that motivational catalyst to give you the motivation to make those steps each day in alignment with who you see yourself? So give us a little spiel about professional identity and how that ties into purpose and relevance, a part of our GPS framework.
Absolutely, DJ. And for our scholars, we're becoming physicians. There is an identity with becoming a physician. There's an identity of responsibility, compassionate engagement, empathy, but also that identity has associated with it an accountability in learning, which is part of our growth and our thinking skills and problem solving. But also, there's an identity for wellness.
Yes.
Because how can we participate in supporting the wellness of others, our future patients, if we ourselves are not well? So, professional identity on this journey to physicianship really helps us stay anchored in what is my purpose in everything I'm doing? My purpose is to help others.
Right.
How about I start helping myself? Helping myself means having that growth mindset to start. Because the growth mindset with the mentorship and the mastery, connecting with strategies, looking at my wellness for resilience will keep me anchored. Then I go to my purpose and relevance. Why am I doing that? Because I'm preparing myself to be ready to solve a lot of unique problems in medicine. It's one of the most intimate aspects of the human condition,
Right.
one's health. So it requires me to be adaptive. It requires me to be ready to serve in a way that means I have to be anchored in wellness, both physically, spiritually, emotionally, so I can now be available to someone else. That takes a lot. And so when I keep my purpose and my relevance, I have motivation. That's what I want to be doing. That's what I want to be doing. So let me take a step back from the stressful moment, the long day of studying or long few days of studying. Let me re-examine what I'm doing to take care of myself because I got to get back in the process. And that's going to take a little work. So the reflection, as we said, as part of our professional identity of where I am, yes, in my goals, but also how am I doing along the way? Because how I'm doing emotionally, physically, spiritually, etc., allows me then to push toward my goals and to work with others, my mentors, etc., my peers, to accomplish that. All of it works together. As we know, and you're going to be sharing, that's why the model, we're going to get to the S in a moment, but the GPS model is together because we need all of those points.
Right.
The second point with the growth mindset, that that sort of purpose and relevance is so critical to our growth because it's anchored in our professional identity.
Now, when we also talk about our purpose and relevance, this is something that I often talk about is redefining success, right? What does
Absolutely, yes.
success look like? And this brings in that skill of reflection, which is going to aid you significantly as a practicing physician. But what does redefining success mean? It doesn't necessarily mean I didn't or I'm not going to achieve becoming a doctor, so let me go into engineering. That's not what it means. But a lot of times, especially when you're early in your career at the MCAT stage, the goal, the fixation becomes medical school.
Yes.
You don't see much beyond that, and you do, but you just see yourself white coat, right?
Right.
The
I need to
white,
be admitted to medical
yeah,
school, and the
I need to
MCAT stands between me and
right.
medical school.
I need to graduate, then I need to practice being a physician, all right? However, redefining success is, well, once you get the white coat, once you become the doctor, once you graduate medical school, how does success look as a practicing physician? Now that you have it, that shouldn't be the goal. Does, if you're someone who values family, values community, you're intentionally looking at yourself, even in the MCAT preparation phase, as a practicing physician who's balancing a very strong family life, who has
Yes.
a very strong community advocacy life, and who's doing it very well, and also have time for themselves to be balanced.
Love the way you frame that because part of the distortion and part of the myths that sometimes we see on the social media platforms, watch this one. Oh, you're going into surgery? Well, if you're a female, you can't have a family.
Right.
Absolutely, you can marry and have a family.
Right.
Absolutely, you should be able to do that. You should be able to have a full life in medicine in all those important areas. And that framing, as you just noted, doesn't start down the road. It actually starts now as part of my purpose and relevance, because my purpose and relevance is to have those wonderful joys of life and serve others.
Absolutely. Or to even extend it, if you're someone who values being a part of the global health community, what does success look like as a practicing physician and being able to do, abroad trips, Doctors Without Borders, all of these different things that adds to your value, and to tie it into this reflection piece. You're consistently looking at yourself in that light.
Yes.
We talk about when students are feeling overwhelmed, burnt out, fatigue, it fosters this avoidance, right? Avoidance around your preparation, avoidance around the daily tasks that you need to do that is intimately intertwined with your success as a pre-medical student and future doctor. And so when we are consistently looking at ourselves in the light that not only gives us that end goal of becoming a doctor, how this intertwines with our personhood and how this relates to our goals, this is something that's extremely important. So let's take the last part of GPS.
All right.
This is something that speaks to a lot of what you did at Georgetown for many years, and this is sense of belonging, right?
Sense of belonging. Yes.
Yeah, so let's define this as students' feelings of being respected and valued within their educational community. So, with the Motivation Lab, refer to this as your education environment or educational air, right? Just the air around the student and how they perceive their comfort within the educational environment, and then also their connection with their educators, right? And so something to quote this is like feeling connected to peers, mentors, community, especially important for underrepresented students. So they found that even with having all of the other aspects of GPS, if this S part, sense of belonging, was in some way out of whack, it created some negative impacts on particularly marginalized students or underrepresented students because of their perception or their feelings around the education environment, the education air not being for them, right? So I know you have a lot of information, not only data but anecdotally, about how the fostering as a mentor and educator yourself, as a dean of student learning, how that mentor role or how that administrator role at the academic institution plays on student success. Just give us a little breakdown about that from your personal experience.
It's a very important anchor for all scholars, DJ, to feel that they belong in their community in which they're learning. And in this community, it's community of the journey to physicianship. And I want to acknowledge my colleague, Dr. Susan Chang, who is truly a thought leader and innovator in inclusive excellence in this realm around a sense of belonging. And while at Georgetown, she modeled and executed on a whole initiative called Build and Belong.
Build and belong.
Build and Belong. She designed opportunities to build a community of inclusiveness where each scholar was valued for their different gifts and talents. The faculty and the staff and other administrators are part of this wonderful community that's being built where everyone is sharing and growing together. And when you build that type of community, you cultivate and continually nurture a sense of belonging. And this sense of belonging now empowers our scholars to drive their skills towards success, but also empowers our scholars when they are feeling not well
Right.
to seek help
Right.
and to feel empowered and excited and encouraged about seeking help, because in this environment of medicine, sometimes it's a misperception that if you have to ask for help, whether it be academically or for your personal wellness, somehow, well, maybe you're not tough enough to be in medicine.
Yeah.
This is a big piece. So as a result, DJ, as you've noted, we see through the evidence-based data and literature, all of this wellness challenge,
Right.
burnout, a sense of not belonging,
Right.
depression, so on and so forth.
And even
because-
suicide.
Yes, it's very unfortunate.
Yeah.
Yes, and suicide, because the environment did not create a sense of belonging, and scholars feel isolated, disenfranchised, and therefore sometimes have suicidal ideation. There's a lot of depression. So this sense of belonging and scholars understanding that we want you to seek that out. Sometimes we have to be proactive in creating our community for a sense of belonging when our environment may not have the expertise of a Dr. Susan Chang and others
Right.
who are promoting that. Now, I had the opportunity, of course, to collaborate with Dr. Chang, and this was an area that I focused on a lot from a learning perspective that I had understood from a perspective of educational psychology. When scholars feel like they have a connection, belonging, there's a greater motivation and sense of purpose to pursue whatever the goals are.
Absolutely.
That's in the evidence-based literature as well.
Right.
What Dr. Susan Chang was able to accomplish and then help bring me into a greater understanding, we all continue to learn and grow, is that we can be even more intentional about building communities of belonging.
Right.
And now those two together, when we work together, now learning and belonging framework for wellness are elevated, and we saw greater student performance, but more importantly, less student feelings of isolation. That was the outcome of our research. Students said they felt more connected, less isolated, and therefore felt like they were re-engaging their actual purpose and relevance,
Right.
second part of the P in GPS, which is their journey to help others. Isn't that something that's very, very powerful?
Yeah, and it connects all of the things that we talked about in GPS, that growth mindset,
Hmm.
that purpose and relevance, and that sense of just connection and, belonging to your, not only the education environment, your education area, but the community around your institution. So these things are very important into our anchoring, into our ability of having that reflection, that skill set to be able to see ourselves thriving in this environment. And so the data shows that while the stress, the burnout, the fatigue, and all of these things are very much at play, there are strategies that we can take that makes it a little bit more manageable, right? And so it's not paralyzing. And that's going to bring us into our second
Mm.
section, which is, what does a wellness framework look like from a longitudinal standpoint?